In the past 18 months, we've been faced with one of the greatest public health crises our nation has ever experienced. Local leadership has never mattered more. There's a saying that when the public health system is working well, it's invisible. As we celebrate the work of the Austin-Travis County Pandemic Response Team, let's take a look at two of the critical inflection points from the past 18 months that kept disaster from happening here.
Well, throughout this whole process, there have been a lot of really hard decisions we've had to deal with. The first really hard decision, I think, was shutting down of South by Southwest. That was an extreme measure with a huge economic impact. It was the right decision, and within probably 10 days or so, it was a common decision. But at the time that we made that, it was something that was probably a little bit ahead of the curve.
I think, when you make those recommendations, they are very difficult recommendations to make. But ultimately, we have to be concerned about the health and safety of our community.
We also realized that if we did it, there was going to be a domino effect across the country. And it certainly did. That was really the point, that we saw the economic impacts happen. We saw the seriousness of the community around the country increase in terms of the concern about coronavirus.
The city of Austin and the task force that really took the leadership in responding to this pandemic and protecting our communities, they were really, I think, unique in looking at the data, looking at the science on almost a daily basis in making decisions. Almost any decision you can think of, any major decision that made it into the news, there was probably a graph, there was probably an analysis that the decision makers considered in making those decisions. And so, for example, many people are familiar with Austin's staged alert system. What they might not know is that underneath the hood, those numbers that divide red from orange from yellow, those came out of millions of simulations at the Supercomputer Center at UT, simulations that projected all kinds of possible futures and helped us figure out what are the right thresholds to protect our healthcare systems, but at the same time ensure that we keep our economy as open as possible, that ensure that we can get kids back into the classroom as soon as possible.
Our way out of COVID is vaccinations, 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 vaccinations.
We know so clearly that the vaccination is safe and extraordinarily effective. We know that most of the people in our hospitals and ICUs and ventilators are people that are not vaccinated. If we could just get everyone to do that, we would move past this crisis. But that's much easier said than done.
There is significant vaccine hesitancy for various reasons, and our health disparities. We continue to have concerns about the health disparity and how this response has really impacted our communities of color.
There's a lot that we need to make sure that we learn from having gone through this COVID experience, things we need to change in the future. It has really shined an even brighter light on the disparities that exist in our community. The people that are most susceptible to this virus are the people that are most susceptible to not having access to capital or regular health care. But in this context, we were facing immediate life and death consequences.
The most promising thing is that every day we are one step closer to getting everyone in Austin vaccinated. Vaccines are really our most effective weapon in our arsenal to combat COVID, and the more people are vaccinated, the safer we will all be.
What I'm most proud of is the incredible energy at the local level to come together and do collaborative response in ways we've never seen before. The cities and the counties collaborated. The hospital networks, there are 3 separate hospital networks who usually compete against one another, but they came together in unity to respond to this deadly pandemic.
Austin and Travis County have the lowest rates of deaths from COVID-19 of any city in the state of Texas, and one of the lowest rates anywhere in the United States. And I think it's because of that sense of community, that we had people come together. We had those stakeholders all engaged from the beginning to wage this war with us. And my hope is that we harness that that sense of unity, that cooperation and collaboration, and solve other big problems that we have.
In the darkest days of COVID, it was really an honor and reassuring to be working with this task force. These were brilliant, dedicated people from so many different domains in Austin who were really there day and night trying to do the very best they could for this community. And knowing that our leadership, that the people in our community had our best interest at heart, we're working hard, we're looking at the data, we're looking at the science, we're making good decisions, was really reassuring. And again, it was just really such an honor to be part of this effort.
Hi, I'm Louis Appel, Chief Medical Officer at Peoples. It's so nice to have all of you with us here today.
And I'm Regina Rogoff, CEO of People's Community Clinic. What an incredible story of leadership and perseverance. It's amazing what can be accomplished when we all work together.
We're pleased to recognize the members of this task force. Your tireless work and leadership helped our community maintain a 50% lower mortality rate than other big cities in Texas and across the country. Many more lives would have been lost had it not been for your preparation and decisive response to COVID-19.
This award is given by the clinic annually to recognize exceptional leadership in health. On behalf of People's Community Clinic, we present you with the W. Neal Kocurek Health Advocacy Award.
I'm Senator Sarah Eckhart, and at the time I was the Travis County judge. It was my distinct honor to work on this interdisciplinary team, and I so appreciate the award. The award really goes to the whole team and also all of Travis County and every municipality in it.
Thanks so much. And as the relatively new county judge at the time and until now, I want to say thank you so much for this award. And I want to thank Senator Sarah Eckhart, Mayor Steve Adler, Dr. Escott, now Dr. Walks, and the whole team of people who pulled together to make this vaccination effort come together.
Thank you so much for the award of the Kocurek Award to the City of Austin team. Really proud to be part of it, working on a challenge that has consumed me 24/7 for the last year. Proof is in the pudding. The mortality rate in Austin, half of the state average. If the state had the same mortality rate we have in Austin, 30,000 Texans would still be alive. Special thanks to Dr. Escott and Judge Eckhart, Judge Eckhart, now Senator, now Dr. Walks and Judge Brown. It's always been about the team. We've worked closer than any other community, I think, in the state, and the proof is in the numbers. Thank you.
I'm Lauren Ansel Myers, Director of the UT COVID-19 Modeling Consortium, and I'm truly honored to accept this award on behalf of my colleagues, dozens of scientists at the University of Texas, other universities, Dell Medical School, the Texas Advanced Computing Center, who worked round the clock behind the scenes to predict COVID and to figure out how we can combat it without doing too much socioeconomic damage. And it was such an incredible privilege to serve on a city task force that is like none other than we've seen in the United States, with our leaders and our healthcare systems collaborating with each other, trusting science and data to provide guidance, and helping us all to understand COVID and to make good life-saving decisions. Thank you so much.